So in Unit 3, we will look at the things you are actually going to improve through massage. Most people that you see in your treatment room as a massage therapist will have a reason for visiting you. Be that because they have an injury they're recovering from that needs some assistance, general aches and pains, they want to improve performance, or indeed they are simply looking to maintain their current level of function. We will look at how expectations link to your treatment plan, common causes, as well as a pattern of repair and soft tissue dysfunction. The first place to start is by looking at abnormalities within a soft tissue, something that we would describe as a dysfunction. Now this can be localized damage, tightness, irregularities in structure, postural. In fact, it can be anything that is out of the ordinary. It can also be localized, such as a tight spot within a muscle, or on a larger scale, such as rounded shoulders. Often a dysfunction will present as a symptom, and as a therapist, it is your job to ensure that you identify when this is the case and adjust your treatment plan accordingly. For example, if someone is presenting with excessive anterior pelvic tilt, i.e. when the front of the pelvis is relatively lowered, this will be a dysfunction, but the cause is likely to be tight hip flexors and lengthened or weak abdominals. It is important to identify areas of dysfunction as, if left unaddressed, they may worsen and ultimately cause an injury. This works as mechanics and neuromuscular patterns may be altered or compromised, creating potentially compensatory or poor movement patterns, and therefore a worsening of symptoms, or lead to another issue altogether. It is because of these things that it is important to assess your clients well. People will walk into your treatment room and through assessment you'll be able to identify some symptoms. This may be reported dysfunction through subjective assessment, whereby pain or other symptoms may be reported, or objective, whereby you are able to gain a physical understanding through palpation and range of movement tests. Symptoms of dysfunction will vary between individuals. However, typically people will report pain or some discomfort on movement during inactivity. They may also present with a dysfunctional movement pattern or movement that does not appear normal. You may even spot this as they walk into your room. Through noting any dysfunctional movement patterns, you are able to isolate and test accordingly. Alongside palpation, movement tests will give you an insight into any adhesions, damage, or synergistic dominance. This last element covers any synergist muscles that may have overdeveloped and are working more dominantly than they should. Subjective questions about lifestyle are also hugely important. Once you have an idea of what symptoms you are looking at, it is important to consider common causes, as this may be something that you can manipulate to improve the outcome of your treatment. There is rarely one key cause, but a series of component factors to be considered and addressed, especially when a symptom may be the actual cause of the dysfunction, such as in the case of poor movement. Causes are varied, and it is important to consider and discuss a range with your client. These may be repetitive movement or indeed repetitive inactivity, such as linked to work or hobbies. Stress is a key cause of shoulder or jaw tension. Synergistic dominance is also likely to cause dysfunction, as the weaker muscles do more work. You are likely to come across a range of knots and adhesions that alter the biomechanical movement of the body, and these, along with other compounding factors, can affect joint mechanics or the way the joint moves. Although injuries are typically the result of long-term dysfunction, they also form part of an injury cycle. This is because after we suffer an injury, movement patterns will often be altered to unload the stress on the affected area. This means that other areas take more strain, causing secondary injuries. In one particular case study, a client reported right foot pain over a year ago, with no positive result from chiropody or GP services. We identified a dropped left shoulder and small scar relating to a motorcycle accident 18 months previous. Through treating the shoulder and releasing the fascia chain, this subsequently improved the right foot pain, almost immediately. Some dysfunction patterns may come up again and again. Although we have discussed a number of causes of dysfunction, some are more common than others, and we will look at these in more detail. The first of these is synergistic dominance. As previously mentioned, this relates to joint movement being initiated by synergistic muscles, muscles that should be supporting but not performing the movement. This allows movement to happen, however in a less efficient way, as the synergist muscles are usually weaker and often fatigue more quickly. They typically take over as a result of damage, weakness, or inefficiency in the prime mover. This means that over time, movement becomes more dysfunctional and injury may occur. You are able to do some tests for synergistic dominance, but watching someone move and feeling activation patterns is the best way. Adhesions are the next key point to consider. They are a small lump on palpation, often painful, and can sit within the muscle or between structures. They typically occur after a microtrauma. This might be exercise, which damages muscle fibres on a localised basis, or external trauma. This damage is repaired quickly by the body by laying down collagen fibres in an irregular fashion, creating a small fibrous lump that can be felt on palpation. If adhesions are not addressed through massage, stretching, or other therapy, they can build up, restricting a muscle, often causing pain, and therefore making dysfunctional movement more likely. In time, and where these adhesions interact with nervous pathways, a trigger point or hyperactive muscle spindle may develop. We will be able to show you techniques to address these specifically at level 4. Both of these factors, combined with tight muscles and any aches and pains, can lead to altered joint mechanics, whereby movement quality and range may be compromised. This in turn can cause a reduction in movement, reducing the fluid dynamics of the joint and reducing joint health, initiating again the injury cycle. A cramp is often described as a dysfunction, especially where repetitive. Cramp is a sudden, uncoordinated, prolonged spasm in a muscle, causing it to become taut and painful. It will usually present as very painful, with a small lump surrounded by a dip. Massage will often help to improve the circulation and condition within the muscle, and therefore help to alleviate pain short term and reduce the recurrence long term. The causes are not clear, although are thought to be related to tight muscles and low salt, so potassium or sodium, within the contractile unit. Dehydration has also been proposed as a theory. In the past, glycogen depletion has been thought to initiate cramp, as the muscle no longer has energy to contract. However, they have proved that even in complete fatigue, there remains a level of glycogen within the muscle, so this is not the case. Most people will look for assistance from a massage therapist once they have an injury or a noticeable dysfunction, and that is where it is important for you to be able to effectively assess and prevent any dysfunctions from initiating the injury cycle.